Hi learners, and welcome to another mini lesson for Chapter 11, Blood and the Language of Hematology. In this video, we are going to cover the white blood cells and some of their disorders. White blood cells, abbreviated WBC, are also called leukocytes. Leuko means white. They are the only one of the formed elements that are complete cells, meaning they have a nucleus and all the usual organelles. They account for only about 1% of the total blood volume, so they are far less numerous than red blood cells. They form a critical part of our body's defense against disease and help protect from damage caused by bacteria, viruses, parasites, toxins, and tumor cells. These highly specialized cells are able to leave the capillary blood vessels and move to where they are needed to provide an immune or inflammatory response. Remember, red blood cells couldn't do that. The red cells could only go where the blood vessels carried them. We describe leukocytes as either granulocytes or agranulocytes. Granulocytes contain granules within their cell membranes, and agranulocytes do not. Remember that A or an means without, so agranulocytes are cells without those granules. So let's start with the granulocytes. Neutrophils are the most numerous white blood cells and account for about 50 to 70% of the white blood cell population. Neutrophils are large cells about twice the size of a red blood cell. The nucleus of a neutrophil typically has 3 to 6 lobes, so these cells may also be called polymorphonuclear leukocytes, or PMNLs. These cells are super important in the body's defense against bacteria, and their numbers will increase dramatically during a bacterial infection. These cells will phagocytize not only bacteria, and remember, phagocytize means the cells will eat and destroy, but they also will eat and destroy fungi and some viruses. Eosinophils account for about 2 to 4% of the total white blood cell count. These cells usually have a nucleus with 2 lobes connected by a band of nuclear material. These cells are important in the response against parasites and also in allergic responses. Basophils are normally less than 1% of the total white blood cell count. The basophils release histamine during an inflammatory response, which causes vasodilation and attracts other white blood cells to the area. They also release heparin, which prevents blood clotting. The next group of white blood cells are agranulocytes. These include the lymphocytes and monocytes. These cells lack visible granules under a microscope. Monocytes are the largest leukocytes and make up about 3 to 8% of the total white blood cell count. They are able to leave the blood vessels and become macrophages that phagocytize bacteria, dead neutrophils, dead cells in the tissue, and some parasites. They also fight chronic infections like tuberculosis. Lymphocytes are the last of the white blood cells and make up about 25 to 35% of the total white cell count. They are the smallest of the leukocytes, and these cells are produced in the bone marrow and migrate to the lymph tissue, so there's almost none found in the bloodstream. They are found almost exclusively in the lymphoid tissue of the body, like the lymph nodes, the spleen, and the tonsils. The 2 main types of lymphocytes are B cells, which produce antibodies and immunoglobulins, and T cells, which directly attack infected cells and tumors. Now let's discuss some disorders of the white blood cells. In a normal specimen, a cubic millimeter of blood contains about 5,000 to 10,000 white blood cells. So what does this mean? That means if I'm looking at a lab report, I want my number for white blood cells to be between 5 and 10. Now this range depends on the lab, of course, so look at the normal reference range that's always provided on the report. But the normal range is somewhere, your book says between 5 and 10, I've seen it anywhere from 3.5 to upwards of 15, but the lab always provides a normal range. Leukocytosis is the condition of having a high white blood cell count, or sometimes we simply say a high white count, higher than the normal range. The suffix "osis" means condition of. Some causes of leukocytosis include neutrophilia, which is an increase in the number of neutrophils. Neutrophils will increase with bacterial infections, so something like appendicitis or pneumonia, or literally any bacterial infection. Eosinophilia will cause leukocytosis, and this can be due to a parasitic infection or allergic reaction. And finally, basophilia will occur with prolonged infections like flu, chickenpox, or tuberculosis, and cause leukocytosis. Leukemia will also cause an increase in the number of white cells, but the condition is very different. Leukemia literally means white blood, And this term refers to a group of cancers that causes an overproduction of abnormal white blood cells that don't function properly. The abnormal leukocytes take over the bone marrow and cause a decrease in red cells and normal white cells, and also platelet production, leaving the body vulnerable to infection and bleeding. There are several types of leukemia. Myeloid leukemia is characterized by an uncontrolled production of granulocytes. Lymphoid or lymphocytic leukemia involves the uncontrolled production of lymphocytes. The most common form of childhood cancer is acute lymphoblastic leukemia, or ALL, which is curable with chemotherapy, bone marrow, and stem cell transplants. Leukopenia is the opposite condition. Here, the number of white cells is too low. The ending penia means deficiency. An abnormally low white count can be caused by certain medications, especially chemotherapy. Neutropenia is a deficiency of neutrophils specifically. This is especially dangerous because neutrophils are responsible for the body's ability to fight infection. You may see hospital patients on neutropenic precautions if their neutrophil levels are very low and they are immunocompromised. The patient must be protected from infection because they are especially vulnerable. These terms also describe disorders of various leukocytes. Remember, the suffix "osis" means condition of, and here we're talking about too many of these specific cells, and penia means deficiency. So monocytosis is an increase in the number of monocytes, usually caused by chronic infection, and monocytopenia is a decrease in the number of monocytes, which can happen after chemotherapy. Lymphocytosis is a high number of lymphocytes, which can be caused by infections, especially viral infections like HIV and mononucleosis. And lymphocytopenia is a decrease in the number of lymphocytes, which can be seen in AIDS, malnutrition, chronic viral infections, and some parasitic infections. And finally, pancytopenia occurs when there is low levels of all of the blood cells, red cells, white cells, and platelets. Pan means all, and pancytopenia is most often seen following chemotherapy in cancer patients. Okay, and here's all the abbreviations from this section of the text. ALL was the abbreviation for acute lymphoblastic leukemia. IG means immunoglobulin. MM with the little 3 means millimeters cubed or cubic millimeter. That's the unit of measurement when we were talking about the number of white blood cells in a specimen of blood. And PMNL was polymorphonuclear lymphocyte. All right, so that's it for this video. Thank you for your attention as always, and I will see you next time. Thanks.